Picture this. You finally arrive at your dream vacation destination, a full week ahead of you. Monuments, museums, and endless streets to explore. The first day is intense but amazing. Then the second day comes, and you start feeling a little discomfort under your foot. By the third day, every single step hurts. Suddenly, your dream trip turns into a nightmare, and you are wondering, did I just develop plantar fasciitis? And fear creeps in. Well, the good news is that this happens to a lot of people when they suddenly start walking much more than usual. And most of these people make the same mistake without even realizing it. Let me welcome to our guide on how to fix plantar fasciitis. By the end of this video, you will understand why plantar fasciitis appears, what actually helps it recover, and the only exercises that are needed to fix it for most people. Let's get into it. This is the human foot seen from the bottom up. If we go from deepest to most superficial, here are the bones, muscles, and connective tissues. One of these pieces of connective tissue is what we call the plantar fascia. This tissue originates in the heel and runs along the foot to the base of each toe. Its main purpose is to support the arch of the foot and absorb impacts, acting like a natural shock-absorbing cushion for the foot. Now, these connective tissues in our body sometimes undergo a pathological process called tendinopathy. For simplicity's sake, we will not get into the discussion of what tendinopathies are, because it gets too complicated for this video. Just know that fasciitis is a type of tendinopathy that affects the plantar fascia. I will leave you linked a video we did specifically explaining what tendinopathies are in more detail. This process involves the degeneration and increased reactivity of the tendons in our body. This usually happens because of a period of sudden or repeated overuse of these structures, although sometimes can happen without a clear cause. Factors like age, gender, and physical demands predispose people to certain types of tendinopathies. The case we mentioned in the introduction is a very common case of walking-related overuse plantar fasciitis. It is very typical for it to appear during travel with lots of sudden walking, like those involving plenty of tourism, where we try to cram as many places to visit as humanly possible. They also happen when going to the beach, where we add the stress of walking long distances barefoot or in open footwear that we are not used to. Our fascia essentially goes into a reactive state. There is so much demand placed on the tissue that it can't adapt soon enough to its new loads, and thus becomes painful under stresses that were not painful before. It is the way your body tells you that you've done too much too soon. As you can see in this graph, this was our baseline tolerance before injury. This is what we were used to. Let's say our body had the capability of doing 10,000 steps daily, and then during our travel we go over it and we do an average of 14k steps a week. Well, these new repeated demands make our fascia become stressed, become reactive, and thus painful. And we will see the repercussions of this state later. The good thing about tendinopathies is that they are not painful forever, and they can be treated. I'm sure some of you watching have experienced an episode of plantar fasciitis in the past that resolved on its own. There are two ways to fix it: an active approach, where we perform a rehabilitation program like the one I'm going to show you, which will probably solve the issue within 2 weeks to 5 months. And then there is the passive approach, where we do nothing and have it become so incapacitating over the course of months that it limits our activity so much that it forces rehab onto us by making us stop doing all the activities we love for some time. Then we slowly reintroduce them when symptoms improve. This passive approach, however, is much slower and more painful, likely to take more than 5 months to recover. Since you have taken the time to watch this video, I'm guessing you are interested in the more active approach. Let's see what the rehabilitation process consists of. Pain varies a lot during the course of the injury. I'm going to explain a bit more about how this condition works and what kind of psychological framework we should adopt in order to improve our pain. Pain in this type of injuries varies a lot depending on the day. Of course, the level of activity plays a big role, but there will be days with lots of walking and no pain, and then there's with barely any walking and lots of pain. This is completely normal. These fluctuations in pain levels don't mean we are worsening the injury or damaging our tissues. This is simply how tendinopathies behave. Pain is an alarm signal, not a true indicator of damage. Since our fascia is in a reactive state, it will constantly trigger this alarm signal. What we need to do is accept this alarm as part of the normal process of the injury, not as the injury itself. This doesn't mean pain is not real, but it is not something we should worry about too much in this pathology, as long as we know we are doing what we need to do in our rehab and functional improvement is happening. Functional improvement means that we can walk longer distances or perform activities that were painful before. I recommend reading the book Explain Pain by Dr. David Butler and Dr. Lorimer Mosley if you want to know more about this fascinating topic. Sounds crazy, but recent pain research shows that understanding how our condition works and seeing pain as a normal and non-harmful part of the injury process actually decreases the pain we experience. If you are already in this travel or vacation situation and you can't really afford to stop walking, there is nothing wrong with that. Just embrace the situation, knowing there will be some discomfort, but that everything will get back to normal once you are able to invest more time into taking care of your feet. Since damage, as we said, is not permanent. Load management. If I had to say which is the single most important part of our routine to fix fasciitis, this would be it. But before we continue, I've got something to tell you if you are still feeling pain from plantar fasciitis. The goal of this channel is to provide high-quality, evidence-based physiotherapy information that helps as many people as possible. And for many viewers, the exercises and strategies from these videos are already enough to start improving their symptoms. But injuries are rarely one size fits all. Two people can have the exact same diagnosis and still need completely different approaches, depending on their symptoms, activity levels, and injury history. That's simply one of the limitations of YouTube content. Even when the information is high quality, it can't be fully tailored to your specific situation. That's why we offer online consultation services. During a session, we go through your symptoms, your training or activity habits, your injury history, and how your pain behaves. From there, we can help you build a clear and structured recovery plan designed specifically for you, what to temporarily avoid, and how to progress safely without constantly guessing what to try next. If you are dealing with persistent pain and feel like you've been stuck for a while, you can find my contact email in the description and send me a short message describing your situation. And if the advice from these videos is already helping you improve, that's great, just keep going. Alright, let's continue with the video. Let's get back to load management. Remember the mistake I mentioned at the beginning of the video? This is usually it, doing too much too soon. What do we mean by managing load? It means making an active effort to control the walking and exercise demands we place on our feet. When being in a state of established plantar fasciitis, our tissues have a decreased tolerance to load compared to our baseline non-injured levels. This is the point at which we were before, where during our vacation we were doing 14k steps during the first few days, and now, after these levels of stress, our tolerance to walking has decreased by a lot. Now we are on the 6,000 steps per day level, and this will be the amount of steps we can do without any pain. As you can see, we did too much for a short period of time, and now we can't do the amount of walking we could before without any issues. Now, as we said, there will be, let's say, a 6,000 step threshold where activities will start becoming painful. The thing is, this threshold will vary from day to day depending on different factors. Now, there will be some triggers that are somewhat in our control, like our stress levels, our amounts of exercise, and our amount of sleep. And then there will be unknown or uncontrollable triggers that are completely out of our control. This is what we mentioned before, where some days without an apparent reason we will experience extremely high levels of pain. What I want you to get out of this video is that is completely normal. It's bound to happen. Now, our objective is to find on an average where this painful threshold lies so that we can have some sort of control over when and how it hurts. And a great way of doing this is by using a step tracker, also known as a pedometer on our phone. This way, each day we will track our step count and have an objective measure of how intense our walking routines are during a given week. And then we can use that information to our advantage. So imagine you track your step count over a week. I'm gonna throw in a graph. Don't worry about the amount of information, I'm gonna explain it slowly. So in this graph, we have recorded each day of the week how many steps we were walking. As you can see, on day 1, we walked 3,000 steps. Let me write here, it will be around here, which is 3,000 steps. On day 2, we did 7,000 steps. And on day 3, we did 14,000 steps. Then the red line represents the pain levels we got each day on a scale from 1 to 10. So first day we got a little bit of pain, which is 2 out of 10. On the second day we got absolutely no pain, which is 0 out of 10. And then on the third day we got a lot of pain, a 7 out of 10, and so on. As you can see, what I wanted to show you from this graph is that there is days with lots of activity and lots of pain, which is what we may expected result. But then there will be days with lots of activity and no pain at all, like here on day 5, where we experienced no pain, but we did a lot of steps. However, we can see that there is a tendency that when we go over certain level of steps, like on day 2, where we did 7,000 steps, the day after we got a lot of pain, okay? The day after being day 3. Then on day 3, we did a lot of steps again, and on day 4, we had a lot of pain. But then as you can see, on day 4 and day 1, where we did below 4,000 steps, we got no pain the days after. What does this mean? That under 4,000 steps seems to be a reasonable amount of steps where we get usually no pain. If we average this during the course of a week and ideally during the course of a month, we end up seeing a tendency which is what I called a tolerance threshold. This means that usually when we walk under 6,000 steps, we feel no or little pain the day after. When we go over that threshold of steps, we usually feel a lot more pain the day after. Of course, this is not perfect math. As I said, the human body is random. It does weird things a lot of times, but it's a good baseline to understand that we can walk kinda safely 6,000 steps. And if we go over that, we are gonna experience pain. As you can see, based on this week's data, we could estimate our tolerance threshold lies somewhere between 5,000 and 6,000 steps, where it is likely we feel some sort of discomfort. This is the average amount of walking we know we can handle comfortably for now. Our goal should be to stay daily around this amount of steps to control our pain, progressively increasing it over the course of the following weeks. If for whatever reason one day you go over this amount and experience pain, then don't worry. You now understand that you simply did more than your body could handle, and you'll just experience some temporary discomfort. Monitoring our steps and pain levels is an extremely valuable tool for quantifying improvement over time so that we don't lose motivation. The idea is, if we were to do this chart over the course of a couple of months, to see a positive trend in the amount of steps that can be walked and a decrease in the experienced levels of pain, with its occasional spikes. Then there is tracking activity or managing load during exercise. If you attribute your pain due to activities like jogging, dancing, martial arts, or any other sports, you have to also manage how long and how often you perform each of these exercises. For example, for jogging, try decreasing training intensity by setting non-painful goals. Imagine you were jogging 4 times a week for 10-kilometer runs each before pain appeared. Well, it's safe to say, depending on how intense your pain is, you could have to resort to only doing fast walking sessions at first, increasing pain and distance every session if pain allows. After a couple of weeks, you can probably start a slow pace jogging again. Keep increasing intensity in a progressive manner over time to return to your baseline status. Same applies for dancing or martial arts. If you are training twice a week for 1 hour and 30-minute sessions, try decreasing the duration of sessions to half of that. Also avoid at first the most painful exercises until we increase tolerance. First, what we don't need: stretches. Even though they commonly appear in tendinopathy exercise guidelines, recent research suggests they may actually irritate the tissue more, so avoid doing them for now. The same goes for foam rolling, pressure, or massage in any of its forms. They are not really worth doing. They may provide short-term relief, but are probably irritating the tissue more in the long run. Now, let's talk about the two exercises I mentioned earlier. The only exercises you truly need are two: heel raises and toe curls and extensions. Why these exercises? Combined, they represent the most fundamental movements that stress the plantar fascia during gait. Doing these movements in a focused manner and at a higher intensity than when walking will trigger greater adaptations in our body. How to perform these exercises? For heel raises, we will start standing in front of a chair or a wall. We will slowly raise our heels so that we are only standing on the base of our toes. Then slowly come back down. We want to perform the ascend and descend slowly as to avoid bouncing, which we don't want. Then we could progress the exercise by performing it on a stair, adding range of motion to the movement. We could then move towards performing it on one foot or weighted. Last steps would be adding some sort of jumping in place and plyometric exercises. Then for toe curls and extensions. This is an exercise made up of the combination of two. I decided to combine them in a single movement as to make the routine simpler. We want to place a towel below our foot, and what we want to do is to first curl our toes as to grip it, then slowly release. After that, we will try to lift our toes up towards the sky and then relax. This would all count as one repetition. In this exercise, focus more on increasing the strength of the contraction, repetitions, and sets, since it's much more difficult to progress in terms of load. In regards to footwear, the quick and simple answer is: wear what feels best for you. Typically, sports shoes will provide better tolerance compared to open footwear like flip-flops or harder soles like high heels. Try out what feels better for you. Some people may feel more comfortable with more cushioned footwear, while others may feel more comfortable with minimalist footwear. Whatever helps decrease your pain is fine. The same applies to insoles. If you are working with your podiatrist and you have been using custom-made insoles for years, there's no need to change anything. In the same line, if you've never considered using custom insoles, then it is probably not necessary that you do so. Heel pads for fasciitis can also be helpful for many individuals, decreasing pain and allowing better adherence to rehabilitation. Tools to manage pain. If pain is really intense and you really need or want something to help you get by, I will show you some tools we can use at home that actually work. I will also leave you linked a video I did in the past where I explain everything in more detail. Remember, as always, these are not what will fix the issue, but something to help us stay motivated to perform these steps we already talked about. TENS can be helpful. Use high or low frequency TENS applied in the painful areas. Each device is different, but instruction manuals will usually show you how to do it. Any form of heat available will provide great temporary relief. Warm packs, baths, or heated blankets can help too. As I also explained in more detail in that video, I personally wouldn't recommend ice therapy. All this being said, one takeaway you can take from rehabilitation in general is that if you like certain treatment because it feels good for you, even if it is not optimal or recommended, even by me, and it helps you stay motivated to perform the other recommended therapies, then go for it. And as a quick note, you may be thinking, okay, this was all great in terms of how to fix the issue once we have it, but what could have been done differently? Is there any way to prevent these injuries from happening? Well, as always, it depends. But I will say preparation is key. We can't really expect to go from a sedentary office job to intense physical demands with no preparation in between. What I would recommend is that if you are planning a big trip and you have a sedentary lifestyle, then start preparing some weeks to a month beforehand. And this doesn't mean doing anything extraordinary. Just start having more frequent and longer walks every single day so that you progressively get closer to the amount of exercise you will be doing during your trip. Having an active lifestyle in which we regularly perform strength and cardiovascular training is a great protective factor against these kind of injuries. If before we said plantar fasciitis appeared because we did too much too soon, exercising is a way to prepare our tissues for intense activities so that it becomes harder to experience these injuries. This doesn't mean they can't happen again, but it's the best thing we can do to decrease the chances of them happening. Thank you so much for watching and for staying until the end. I hope it was helpful and you are on your way to fix your pain in your feet. See you next time.